Welcome, everybody, to the kickoff of the fall session of Health Impact. For those of you that joined us a couple of months ago in July, it just seems like yesterday, but we did have most of this panel in a variety of different ways talk to us, and especially with Ashima. She led the panel last time, finishing the conversation that we had in July around innovation and transformation. So what we thought is we'd kick off this session over the next couple of days with starting off on the topic of sustainable transformation. We've all seen that things have changed. The big question is what stays and what doesn't, and more importantly, how? So with that, I'm going to have our esteemed panelists just introduce themselves real quickly, starting with Ashima from the Google Cloud Platform team, and then we'll go to Rasu and then to Chris. Then I'll kick off one of the starting questions.
Thank you, Shahid. Always a pleasure to be here. Thank you for inviting me back. Ashima Gupta, I lead our product and solution strategy for healthcare and life sciences at Google Cloud. And ex-Kaiser Permanente, been in the industry for a long time, so excited to be here.
Excellent. Rasu?
Thank you for having me back as well. So must have said some things right that we deserved a reprise here. So Rasu Shrestha, physician by background. I'm the Chief Strategy and Transformation Officer here at Atrium Health. And I lead a number of things across this pretty large not-for-profit health system here, including our strategy and planning, our innovation, as well as a number of things in terms of our consumer strategies.
Excellent. Chris?
Good to see this crowd. I always learn a lot in talking with colleagues here, and excited to represent different parts of the country. And we are Sutter Health and run innovation here, came from IDEO and One Medical, where we're looking at a human-centered look at transformation of care and working that into, we are the 7th largest healthcare system in the United States, and very reflective of the US at large, given the diversity of Northern California and all that exists between the Central Valley and the technology of Silicon Valley.
No, I love it. Yeah, this panel is going to be great. So let's kick this off, Ashima, asking a question like what's changed in the last couple of months since we last talked. And recently, Google invested in Amwell, about $100 million, if I'm not mistaken. You were part of the team that helped get that business development deal done with Google. Tell us, what was the thinking for a tech-heavy company getting into a virtual-first telehealth type of company, and what are you planning to do with that partnership going forward?
Thank you, Shahid. From Google Cloud perspective, we are committed to helping the healthcare industry transform to meet the extraordinary challenges being faced by COVID, and help them build a platform layer for the future that enables high quality, efficient, and cost-effective care. And as in our pursuit in helping the I was part of the team which was preparing for a COVID-19 response from the Google perspective, and we had an intake process. And we got over several hundreds of requests coming to us, and not just from the US, but globally, be it Latin America, Japan, Asia, New Zealand, Australia, even India, in asking for the telehealth type of solution. And it was pretty clear that this is a new reality, and COVID forced redesign of the care systems, be it from the primary care, secondary, community, acute care, and as we were looking into these requests, it became pretty clear that the industry needs a solution and they need it now. So we had to kind of re-look into our portfolio, and telehealth, if you'd asked me in Jan and Feb, yes, it was there. It was not on the fast track. And now here we were in April, May timeframe, and it was the forefront and first request that was kind of coming in. So we really looked hard as to should we build, buy a partner, how should we help our customers. And in that light, we started looking into, if we have to build the system, yes, probably we can build it, But what Amwell brought with it is not just a product, but a network. We already are deployed in thousands of hospitals in the US that are robust, fair ecosystem. It became pretty clear that by partnering, and we are a technology company, we are not a telehealth company, so this became a kind of perfect marriage. That is a telehealth company, they need infrastructure to scale. So there are three areas of our partnership, if I may just go a little deeper on that. First is they are migrating over to GCP. The telehealth demand skyrocketed during pandemic, and even though it has come down, it's still much higher, 10 times higher than what it was before. So getting them onto the Google Cloud, providing them a secure enterprise-grade infrastructure was the first pillar. The second pillar, which is the most important and inspire us, is telehealth as we know it. It's a broad umbrella, right? It talks about being from virtual care to primary care to remote patient monitoring to really store and forward health, remote diagnostics, and really acute patients from the hospital at home type of use cases. So this is all hinged upon data, and Google is a kind of data company. Can we help take our AI machine learning capabilities that we have built and bring into the telehealth experience? So the second pillar is around co-innovation, bringing our capabilities in like medically tuned NLP, in medical translation, transcription, and bringing that into that video visit experience. And the third is go to market globally. Amwell is a US-based company, and as I was mentioning before, this demand was and it still is a global need. And we believe Google's presence in multiple countries worldwide will help take Amwell product to and bring it to the front lines. So again, just to summarize, as we were looking into our portfolio, this became our way of addressing the market need. Time to market is important, and we had to pivot, and that led to the partnership.
No, I love it. In fact, what I love about it is the fact that it wasn't a bunch of smart people sitting in a room thinking, what could we do? It was customers banging on your door saying, what do you have for me? I think that's what's most exciting, is that the demand side was driving this, and that was excellent. So Rasu and Chris, I'll start with Rasu. I'd love for you to maybe almost critique this purchase or this investment by Google in a couple of areas. Maybe the question of, does what Google is doing worry you? Does it please you? Does it frighten you? Like, what does it do for a large integrated network in the East Coast, and then of course a large integrated network on the West Coast? What does that mean to you guys, and what does it say about how you have to innovate at your health systems to either consume what Google is doing going forward, or be worried about it and be able to handle it from a competitive point of view?
Yeah, so it's really interesting. We stand back and are actually really excited about some of what we're seeing play itself out there. And I think this partnership between Amwell and Google is a key example of how things are changing in front of our very eyes amidst this pandemic. And rightly so as well. And so we're standing back and applauding this forward leap in embracing virtual and digital in the right realm. The spirit with which Google is entering into this partnership is, I think, is exactly what we need more of in the industry here. So, what was the norm just even a couple of months ago, as we look at the early part of 2020 or way back in 2019, waiting rooms, right? Folks coming in and getting in-person care, whether it's in primary care practices or whether it's for anything from coughs and colds to follow-up appointments. Today, it's quite the opposite. Today, even as we're struggling with the realities of how the pandemic is playing itself out, even as we're looking at and waiting for the vaccine to come, even as we're struggling with the realities of the twindemic, as it's been called, the pandemic, as well as the flu virus and the flu epidemic that's going to be hitting us. We're really realizing that virtual is not just a set of capabilities that we turned on at the beginning stages of the pandemic and we capitalized then, but it's here to stay. So with that, what Google is doing, I think, is great. And you're seeing a lot of traction in the industry. What I'd throw out there, and this is perhaps a bit of a challenge, what I'd throw out there is it's not an on and off switch. It's not a black and white, is it virtual care versus in-person care, right? It is a continuum. And I think Google is really smart to realize this, and there are many others that are quickly realizing this. But from a health system perspective, I think the opportunity that we have is to partner with the likes of Google and others that are out there, but to really nail it on the head when it comes to that continuum. Because it's not a black and white, it really is a continuum. It's the reality of, all right, as we step into this next normal environment in a post-pandemic reality, we're going to have to embed AI-powered chatbots with virtual video visits and COVID-safe in-person visits as needed into more of a seamlessly cohesive experience for that patient, for that consumer that's at the other end. And I think that's what this new reality is going to be about. And it's not just for the coughs and colds and for the quick consults that virtual care has been known to be capitalized for, but it's, I think, for almost everything. So even if you can imagine a person that perhaps needs to come in for a surgical appointment, we may not be able to do surgeries per se virtually, but imagine that person coming in and checking in virtually for a lot of the pre-surgical appointments, and then a number of things that we then basically do post-surgery, all virtually as well. And it's this cohesive nature of how we're able to weave in virtual as well as in-person and provide to that patient, provide to that consumer sort of the experience that is much more elevated than what they were used to in the past. I think that's the new reality that's here to stay. And I'm really excited about that.
Cool. No, I think there's a great response to that. Chris, if you were to critique or tell us a little bit more again about how you're feeling, worried, pleased, excited, like Rasu is, tell us how you're thinking.
Yeah, well, certainly I wouldn't critique it at all. I think what I'm seeing is the best of many, many entities that are getting into healthcare in some profound ways right now. They're showing their best selves. They're pushing the agenda. They're building and bringing forth what their capabilities are into this space. And that's happening all over the place. And I think that is fantastic for end consumers. I think that's great for the reduction of what it costs to deliver healthcare in the United States. I think it's exposing enormous power, such as what Google can do with its cloud in terms of commingling data sets to make profound decision-making for providers or population health, et cetera. I think that's great. And as an innovator, I think we need to race towards that. I think people will trip up short term around, okay, is this problematic? Is this competitive? And I think all of that is very short-term thinking. Long-term thinking, this is just a new shuffling of intertwining, as Rasu was pointing out. Babies are still going to be delivered in person, as far as I can tell. I mean, I'm excited about the day maybe where that's not happening, but that there's maybe a rejiggering of how that happens, and the before and after becomes cleaner, and the digitization of that becomes so elegant, and the data and information makes that more predictable and safer, and all that can come to be. So, and I think maybe it's helpful just throwing in different examples. Like, who thought Lyft in ride-sharing services would be entering healthcare in a big way? They're having big impact on healthcare and transportation of goods and services, and now Uber with food. What's that look like? And I think that welcoming those powers to be in this new arena is, to me, to be applauded, not slowed down or seen as threatening. I think it's all great news, and it'll be around the innovators to design what that commingling looks like and expressing it in the best possible way.
Yeah, and so what excites me is that as Google is wont to do, these things become APIs. So if you think about, imagine having a fleet of physicians available as an API, right? That's what I see 5 years from now, 10 years from now. Very similar to many of you probably know Amazon's Mechanical Turk or other tools. You know, you don't really find healthcare professionals as a Mechanical Turk. But imagine that these capabilities of being able to get a midwife when you need one, or being able to get a physician when you need one, so that this blending of what is at Atrium or Sutter, where geography seems to no longer matter at the moment. Chris, you said this last time, and I think earlier today, that geography is no longer important. So what makes the upcoming innovations possible is this idea that not just technical resources are available from anywhere in the world, but medical resources. That's what telehealth, and especially this investment in Amwell, has shown, is that there is a there because Amwell has fleets and networks of these physicians, and that those still matter, right? It's not the virtual part of it that's the most important. It's the fact that there are humans that are now more accessible. And so when you look at that innovation there, what I'd love to do is to talk a little bit about the difficulty that care providers are going through today because of financial problems. You know, not that the Atriums and Sutters of the world probably are more immune to this than your middle of the road revenue problems that folks are having in the rest of the country. So how does one take the innovations that we know that we had to put into place? We've done that now over the last 6 months. But how are these really sustainable? They were affordable. They weren't affordable before. They're currently not affordable, but we have to do it anyway. Chris, do you want to start off with that a little bit and tell us what do you see could be done to improve the affordability of these kinds of tools and technologies to be more pervasive towards larger parts of the country? Yeah. Or are we doomed to just being able to use this tech for the well-off?
No, I think you're making great points. I think you got to hit it from a couple different angles. One is shift to value-based economics in healthcare, I think is really, really important so that those in-between times are seen as engagement with patients is seen as incredibly valuable, and that's part of the economic structure. I think that's going to be critical, and we'll continue to fan the flames on this, and apologies for that metaphor in the middle of California where we're dealing with so many fires right now. Bad choice of words on my part. However, in addition, looking at who's benefiting right now. So for example, if you're in a rural community and you end up in a dire situation, you're piped into an EICU, your care has gone up tremendously. You're getting world-class care brought to that site. And for rural populations, this is great, right? And we'll continue down that path. That is not true across the board. When we look at, just look at African-American data related to COVID, that's, we should not be proud of that. And there is, as a nation, and we have to do a lot more to make underserved populations the beneficiaries of all this. And there are many layers to this story. You talked earlier about, so what's the plan? You know, what are we doing Monday? One of the basic things to tackle, and we're doing this along with the state of California, is where are we putting in 5G networks? Yeah, that's important. How accessible are those networks? Who's got access? And what's happening is we're not alone in this pursuit. Look at education that's simultaneously reinventing itself on the fly. Education plus healthcare, looking at Wi-Fi access is important. So the fact that they're doing it together is helping both entities, where we see those as two different industries, if you will. They're both benefiting from the learnings around what it means to have those that are benefiting and those that aren't. But you've brought up a great point, which are current healthcare economics, including the system that I'm in. It's tough. It's really tough. So you're reinventing, investing in technology, looking at the digital divide, looking at the inequities, and we do not close our doors to the underserved populations. And so if there's anything we can do is make sure that it's well known across technology companies, healthcare companies, that these populations need it more than ever, and that technology should be seen almost in like a certified B Corp type of way. Is you can't press go until you've looked top and high and low in terms of who's going to benefit from this technology. And if it only goes towards privileged populations, I think we should be ashamed of that. It's like, how do we start with underserved populations for accessibility and technology advancements, et cetera? And there's no better tools than, say, the cloud that we've mentioned before to integrate how an FQHC is talking with a healthcare system, which is creating a better outcome for a population that's getting bumped around different care sites. That's to me one of the ultimate uses of the tool. So lots going on in that space. Yeah.
No, I love it. So Rasu, if you want to comment on what Chris was saying in one specific way, and that is a lot of our audience members are in the technical industries, at least serving CIOs, or maybe on the innovator side ourselves. What are some specific pieces of advice that you would give for us on the technical side to say, hey guys, the same thing you are doing could shift minor this way or that way, and now be super useful to both the underserved as well as the well-off? Because we know as small companies, as big companies, people have to pay for our technology, but how could you get the technology paid for and still serve both of those kind of populations that Chris was mentioning?
Well, this goes to the heart of who we are here at Atrium Health. Atrium's mission is to improve health, elevate hope, and advance healing for all. And it's the last two words, the "for all" part of our mission statement, that I think resonates with just this very conversation that we're having. And when you parlay that against the question that you had asked earlier about innovation, especially amidst sort of the financial constraints that we're dealing with as health systems, and we're not immune to those financial hiccups that we've gone through and the hardships that we're living through right now. Most provider organizations, small, medium, or large, they have a very small profit margin, and it's interesting, especially at a time like this, for them to even stay viable, let alone for them to be innovative, is really, really difficult. I do believe, however, that innovation of any kind, whether it's new market innovation that drives revenue or efficiency innovation to ensure that your system stays open, it must be intricately tied to strategy. And that's essentially what we're doing at Atrium Health, is through what we call our strategy and transformation organization. We're really pulling together this bimodal approach, this balanced approach between exploiting the gnomes of today's businesses, including the financial remediation, including in this environment, managing the elements of coming out strong from this pandemic, and all of the different ramifications in that known entity of the mode 1, as well as the second mode 2, which is really exploiting tomorrow's growth engines and reimagining what it means to, for example, transform care, or to embrace these value-based models that Chris was talking about earlier as well. And the approach that we're taking to all of this is more as a portfolio mindset. And I think that's really important. It's not something that we can set and forget, but it requires a level of active management, especially at a time like this, and an element of, much like when you manage portfolios, rebalancing as our environment shifts, just like you manage your maybe financial portfolio as well, right? So back to our mission statement, when you're then talking about, all right, as you're managing these portfolios, as you're looking at this bimodal approach, serving the needs of everyone out there, including and perhaps focusing first and foremost on the underserved populations, is I think not just the right thing to do, but it is also the thing that allows for us to really sustain the specifics of what it means to provide health and care for the communities that we're serving. It's in balancing this disparity that exists between the haves and the have-nots that I think we can really advance some of these capabilities that we're talking about. So the example around virtual is a perfect example, right? So what we're saying is, when we're leveraging, for example, GIS capability, geo information system capabilities, and hotspotting out our various zip codes across the many communities that we're serving, and we're seeing immediate areas that require a level of COVID testing or require specific types of services, when we are able to truly embrace virtual and deploy these via cloud-based capabilities, we're able to scale up and scale down at levels that we were not able to in more of the physical constructs, right? And we're able to deploy a mix of sort of a hybrid model, whether it's virtual services, whether it's these mobile vans and mobile clinics, especially to the underserved communities and populations that may have bandwidth constraints and such, these mobile vans and mobile clinics, again, served by virtual with specialists that are beamed in from our specialty hospitals or from other areas. It's that type of a hybrid model that we should really embrace, and serving the needs of those underserved populations not only does good for the communities that we're serving, but it also then right sizes the overall financial health of the communities. If you think about sort of, this being an ecosystem of dependencies, right, where you're really not just meeting the needs of a specific population, but you're meeting the needs of the community at large. And I think it's that holistic approach that we should really think through when we're continuing to think about innovations for both the underserved as well as the rest of the population that we're serving.
Sure, and I think that makes complete sense. And when you look at it, Ashma, from Google is literally a portfolio company of Alphabet. So the portfolio style of investment is something you guys are super familiar with. But I'd love for you to talk about a couple of things that Rasu and Chris mentioned, especially the bimodal part. Google sees this bimodal as an important part of your strategy, which was one of the reasons you put in $100 million into Amwell. Talk a little bit more about that bimodal strategy, and then the demand side that Chris and Rasu are talking about, that there are things that they need. What are other things that Google might be working on strategically that could fit the needs of hospitals and health systems beyond what we've talked about already with the Amwell investment?
That's a great question, Shahid. And the bimodal approach, I think we're all dealing with that. Not just in Google, I think all industries, and I sit in the industries org, and so we have retail, fintech, media, what have you. And there's this approach of act now and plan forward. Because the pandemic, and that's Rasu's calling it bimodal, we call it, again, two-pronged approach. What can we do to help our customers today? And then how do you help them plan forward? Because history has shown us that during crisis, you are focused on innovation, you get to the right side of it, where compared to your peers, you are like 2009, people who kind of innovated and not lost the focus. So it is important to keep those both vantage points, and your portfolio kind of reflects that. And also, Rasu mentioned something around financial viability. Like when we take our cues from the customers, when I talk to a lot of provider systems, they're already razor thin operating margins. So now how do you help them? Like it's not the time for, and pardon me for saying that, interesting science projects, like, okay, which has longer term, 5-year horizon. I think that there's room for that, but right now, when you're acting now, it's what can you do now to alleviate the burden? So one good example of that was during COVID, we established chatbots, conversational agents, because the need was the patients for, the phone lines were taking 35 to 45 minutes to get through a nurse, only to be told, oh yeah, COVID-19 test is available, yes or no, or some basic triage. That's where the need was now, right? So we established this AI-based multilingual conversational agent in helping with the triage today. Like that's an application of AI, but much more in the reality of today but it was very smaller niche use case from the AI perspective. And now when you're looking into like remote monitoring, getting all this data, there's so much of a data tsunami that is supposed to be coming with all this wearable sensors information. How do you make sense of that? I can tell you based on my Kaiser days, physicians don't need more data. They do not. What they need is insight. They need the signal, and that will require a very thoughtful approach in getting the data, understanding and building the algorithms that can give you the nudge or the insight, and that's hard work, right? It's all a lot of data wrangling. So when you're planning forward, you know that's where the virtual pivot is. You need to be spending time in creating the data layer, the data platform that's not just going to solve for today's need, but harden the platform for the future use cases. So we saw that for the virtual, from the front office side. The other thing I would also say is the back office innovation, right? So when we are talking, especially in the provider space, there were a lot of furloughs. According to American Health Association, there was providers are losing $50 billion a month, right? That's serious, repercussion in hardship, and many employees were laid off. So now you are doing the same amount of work with less number of employees. How do you make that happen? What kind of innovation you can bring? And healthcare is still run by faxes. Is there a way to automate using artificial intelligence, machine learning to understand the back office processing? I think there's still early days, but we are seeing a lot of demand coming from it, like be it claims analytics, claim processing, provider credentialing, so that requires innovation in understanding the hospital-specific documentation, applying technologies like OCR, natural language processing, understanding, semantics, entity extraction, and converting that unstructured data to a structured data lake that can inform not just the processing today, but also the insights. And I believe you will see a lot of innovation in the back end as we're seeing from the virtual care delivery, the revenue cycles of the world, the claims processing, and fax processing, provider credentialing are the few use cases that we are seeing emerge.
Yeah, so Google is very accustomed, Ashma, to doing things at a high scale with small bits of information for many, many people. But healthcare is a much, much smaller industry. It seems like a big industry because it's got a multi-trillion-dollar spend, but the amount of data that you can work with machine learning and AI, you have deeper data for a smaller number of record sets, as we call it. So has that posed to be a challenge, or you guys have enough data that's coming through your customers now that can help you do the machine learning and AI without worrying about the total size of the data sets?
This is a very pertinent question, and I would answer it like this. We don't have the data. In this cases, especially in the case of cloud, our customers own the data, and it depends upon the size of the data that they have. And the other thing from the cloud perspective, like when you talk about Google, yes, we can do small things but large scale, but almost anything in the enterprise, the customer validation is very important. So we do a lot of early access, we develop our product. In most cases, validation trumps perfection. Like, don't make a perfect product, because healthcare reality is different. And in fact, not just healthcare, any enterprise is very different. So trying it out in the enterprise environment at a much smaller use case, get the validation before you put the resources to scale it, because a lot of learnings that can happen. So the mantra that we follow is early, and I know it's a Silicon Valley mantra, like fail fast, but it truly is fail fast. Like validate, get the customer validation, because either you will learn or you will say, okay, yes, there's a strong signal, this work, and now I need to scale. So in enterprise, you're working very thoughtfully in getting that feedback, and that customer feedback is a North Star in where we will invest, which product will, and we saw that even during COVID, many things got deprioritized, many things got accelerated. So again, the portfolio approach helps you with that determination.
Yeah, that makes sense. So we've got about 8 minutes left before we open this up for our audience questions. So I'd love to do is to ask Rasu and Chris this very important question. There's so much going on. How do you find your true north? So you've got so many different things that are going on. What is your prioritization? And mostly think about this, the audience is listening to you saying, hey, I can help you solve your problem. Well, what is the stuff that you guys are looking to have solved that you would want the GCPs of the world, the Google's clouds of the world, and other innovators that are sitting in the audience? Rasu, we'll go with you, and then hit Chris up right before we conclude.
Sure. So it's interesting, as Google is coming into healthcare and partnering with healthcare organizations like ours, we as provider organizations, I would throw the challenge out there that we need to function in a very non-health system-esque way, right? It's important for us to think beyond the confines and the constraints that have really been holding us back. And I would even challenge, what you brought up earlier, and where you said, that we don't really have too much data in healthcare. And I'm just paraphrasing, but I think you're right if we look at it from the confines of how traditional provider organizations have dealt with data, which is, we're looking at clinical systems in our EMRs, maybe claims data. So we have meds, allergies, immunizations, problems, labs, documents, claims data. But that's just the tip of the iceberg. I'd say if we look really what's beneath the iceberg, if we really expand our purview from a patient-centered approach to care to more of a person-centered approach to care, that whole person care approach is, I think, what we really need to be embracing. And that's the challenge that I've put out there, especially in this really highly complex, volatile, ambiguous, uncertain environment that we're functioning in right now. I think what we need to do is really think and function in a very atypical manner, right? We can't afford to function as traditional health systems have in the past. I think we need to embrace a little bit more of the Google-esque mentality, if I can say so myself. And that's expanding the aperture to say, look, it's not just about the data elements around the care process that we're really good at, but really around the entirety of that transformative consumer experience, the end-to-end approach, that whole person care approach that we need to be taking. So we can, go into data around social determinants. We can go into data around, eating habits and buying patterns and all of that. And I say that because it's important. And that's one thing that the pandemic has shown us is it's not a binary, as we were talking about earlier in terms of virtual versus in-person care. It's not a binary between consumer and patient either, right? It is a continuum. And looking at this more as a transformative consumer experience journey, I think is the right approach for us to embrace. And that's what we're doing at Atrium, is taking all of these different data feeds, but also looking at the experience elements, right from awareness to consideration to selection to care, which is what we're really good at doing, to advocacy, and looking at it from a through and through perspective, and making sure that we're able to then meet the needs of our patients and consumers where they choose to meet us.
No, I love it. In fact, that's a great way of thinking about the consumer part of it as the true north, right? Because if you've always followed the consumer, you're likely going to be successful. Chris, any specific guidance to the innovators in the audience on where your true north is, as you would say, and how they can help you get there?
Yeah, so just building off that same comment set, it's if you want to know true north, look at the big data, right? So of course that tells you here's an underserved community, or here is a disproportionate healthy community that's living quality of life years and very long. Like, that's good information to gather, but organizations sort of stop there. So that will inform their population health strategy, for example. But go sit side by side with someone that has recently lost their job and tried to find insurance and get into their first care appointment, and how incredibly and unnecessarily difficult that is. And that'll unpack 10 startup businesses that need to happen, and so that true north really does come from people. But I think it's very important to point out that people will say they have a consumer strategy, but yet they're still just looking at decks on their computer, right? It's like, really get out there and understand what's happening in the hearts of the minds of people. So if for example, you asked how could systems help, like things that you see in the care team, what we hear often is the interaction with the patient certainly could be improved, but there's a program that we're working on called the Mosaic, which is everybody around that patient. So how do you empower everyone that's considered a care team member, which includes family, friends, community members? How do they all unite using the technologies we've talked about today? And frankly, one thing that we're all under indexed on is creativity, which is how do you creatively now use what's even possible, and then look to the technology to say, is there anything out there that will allow us to do that? So user first, there's a true north, and true deeper truths, not just like, hey, what do you think if we do this? A lot of times we talk about getting a consumer strategy. It's like, yeah, no, we showed it to a few people and they said they liked it. It's like, no. You got to start with them. Like, you're still starting with you, and understand what's going on for them. Use that as inspiration, then maybe go back to them with, we heard you, and then, is this what you were thinking about? Is this what's working? So I think that's a lot of it. And then the technologies there is an amazing tool to enable that to happen. Now that said, there's a totally separate group that's important to listen closely to. And that's your frontline care worker, because they know, they've seen a lot, right? And this is where we get to things like AI and imaging. So what would help a radiologist? Well, it'd be helpful to not have a human processing every single image, right? So right now that starts with sort of dishing up an image that had a second read, but ultimately it'll look at ways that they don't have to look at every single thing. They're practicing at the top of their license. And so, empathizing with the stakeholder chain is really important, because another group would be employers. Try to be an employer in the United States right now. Healthcare is putting you underwater. So what do the employers need? So the important part is empathizing across that stakeholder chain, with the end user being your ultimate true north. But how do you work through, what's that now mean for the physician? What's that mean for the employer, and working your way through that stakeholder chain? So that's a little bit of input that we're thinking about here.
No, that sounds terrific. And I'm going to go ahead and turn it over to the audience to ask your questions live for Rasu, Chris, and Ashima. I want to thank all three of you. And sorry, Rasu, that Chris had to talk about the radiologist instead of the radiologist talking about the radiology. But I'm glad he brought it up. So with that, thank you all. And we'll open it up for questions to our panelists.